Hello, my name is Jennifer Jones, and I'm the Director of the Cancer Rehabilitation and Survivorship Program and a Senior Scientist at the Princess Margaret Cancer Centre in Toronto, Ontario, Canada.
I'm very grateful that BJUI has selected our paper entitled Modifiable Lifestyle Behaviors Impact the Health-Related Quality of Life of Bladder Cancer Survivors as the article of the week in the June issue of BJUI. Modifiable lifestyle behaviors such as physical activity, weight management, diet, and smoking cessation may reduce morbidity and mortality and have been shown to improve quality of life in survivors of multiple other cancers. However, there have been few large studies that assess the degree to which bladder cancer survivors are adhering to current lifestyle recommendations and the impact of these behaviors on their quality of life. To address this, we conducted a large cross-sectional study of 585 Canadian bladder cancer survivors using validated measures in order to describe their health behaviors, including physical activity, body mass index, diet quality, smoking, and alcohol consumption, and explored the relationship between these lifestyle behaviors and health-related quality of life. In terms of physical activity, based on current guidelines, which recommend 150 minutes of moderate to vigorous exercise for cancer survivors, 20% of respondents were considered sufficiently active. For BMI, a large proportion of the participants were overweight or obese. And for diet quality, about half the respondents were eating greater than or equal to 2 servings of fruits, vegetables, or whole grains each day, and 23% reported that they were doing all 3. In terms of smoking, a large majority of study participants had a history of smoking, but most had quit, and only 9% were current smokers at the time of the survey. In terms of alcohol consumption, the large majority of participants were meeting recommended consumption guidelines for alcohol. In terms of quality of life, we evaluated this using the Bladder Utility Symptom Scale, the BUS, and associations with each health behavior and health-related quality of life were examined using an ANCOVA. The adjusted and unadjusted means and standard deviations of the BUS scores are reported by each behavior, are reported here along with the effect sizes. And this shows that meeting physical activity recommendations along with diet quality and not smoking were significantly associated with health-related quality of life. And then here what we did was we also examined whether the cumulative number of net health behaviors, so here, would be significantly associated with health-related quality of life. And in order to do this, health behavior scores were created from 0 to 5 by assigning 1 point for each met health behavior, and people got a score. And then we performed a trend analysis to check the association of health behavior score with total BUS score, controlling for confounders. And there was a positive association between the total number of health behaviors participants were engaging in and their health-related quality of life. And this linear trend was quite significant. So in conclusion, what we found was that the minority of bladder cancer survivors are meeting physical activity and dietary recommendations, and the majority are overweight or obese. We also found that health-related quality of life was significantly associated with not smoking, meeting physical activity and dietary recommendations, meaning it was higher in these groups, and that health-related quality of life improved with the increasing number of met health behaviors. Future research is now needed in order to examine the impact of lifestyle interventions on behavior change and quality of life in this group of cancer survivors. I want to thank you for the opportunity to talk about our study today.